Yes, I love the idea of transformative care because you're transforming the patient from pain and illness into health and well-being at the same time as you're transforming the healthcare system to be more patient-centered, focus on new paradigms, which are really old paradigms, focused on patient responsibility for their own health and well-being and for recovery. So we have this rule called the 80-20 rule. 80% of a patient's success is based on what they do at home on a daily basis. 20% is based on the treatments. And when you look at the randomized clinical trials of treatments against placebo, they really only work 10 to 20% above placebo. But when you add self-care management, you can have transformative outcomes, which is what we really want to achieve with patients with pain. For example, I had an 81-year-old gentleman who was in, and he was retired, relaxed, enjoying himself, except that he had headaches and neck pain every day of his life since he was age 16. He's been through all kinds of doctors, treatments, medications, and eventually he said none of it really worked. So I was seeing his daughter and his wife in the clinic, and he happened to be sitting in the corner. And they were getting better with the model of transformative care. And he came to me and says, well, I wonder if you could help me. I've had a headache every day for 65 years. And I said, well, sure. We just have to identify what are the contributing factors that are driving that headache over time. Those patient-centered factors that really under your control, not our control. So we identified a variety of different factors, from posture to repetitive strain to clenching of his teeth to tensing his shoulders and forward head. And then we worked on treating, with myofascial release, physical therapy, coupled with teaching him how to reduce those factors. And within a couple months, he came back and he was really angry. I said, well, why are you angry? His pain was down to once every 2 to 3 weeks, a headache. And I said, I'm so mad because nobody told me this stuff 20 years ago, 30 years, 40 years ago, so that I didn't have to go through my life with head and neck and jaw pain. And so that model of care, of integrating self-care with treatment, is a critical model that everybody in the healthcare system should implement, regardless of whether it's a pain problem or whether it's another chronic illness. It's just something that we have to do. So transformative care is integrating treatment with self-management training. And the difficult part of that, how do you do that as part of routine care? And that's where you have technology, online aspects, risk assessment, risk reduction training, coupled with a team. And we use telehealth coaches to work with the patient over the phone periodically. So it creates an entire strategy for implementing self-care, supporting the treatment by the physician. And it's easy to integrate, it doesn't take any time, and it's part of what we call preventive medicine services to prevent chronic pain, addiction, disability, and all the negative consequences of chronic pain. So in a nutshell, that's kind of what transformative care is.
In my experience, it's much easier as a physician to tell a patient what to do. The implementation is what is the hard part. And honestly, my patients have fibromyalgia. They're exhausted and they hurt all over. And if I say to that person, you need to exercise, I mean, I would ask you to remember back to the last time you had a bad flu, laying on the couch, feeling awful, aching everywhere. If somebody came up to you and said, you should exercise, you'd just laugh at them, right? And it feels a bit insulting. So what can be helpful is with coaching, whether it's telehealth or in person, helps patients with that implementation. Well, how can I figure out how to do 1 minute of exercise? What kind should I do? So I think it's hugely helpful. And the model of transformative care, bringing that kind of self-care management into the clinic, if we can do that, truly it would make a huge difference, bigger than any medication treatment would.